Friends, today I'm going to say something about the level 2 scan. Incidentally, the clip shows the placenta previa and the baby has cord around the neck. You can see the beautiful cord around the neck. There are 2 loops of cord around the neck in this baby, and the placenta you find is falling short of the fundus and starting at the level of cervix, which makes sure that this is placenta previa. You see the 2 loops of the cord, beautifully loop the cord around the neck. The level 2 scan should be done in 22 weeks, 20 weeks to 22 weeks. Now you see that this is the stomach, the abdomen of the baby in cross section, and the heart can be seen. This is the lateral ventricle, and now you see the BPD at the level of thalamus. In previous scan, you see the CMD being measured. This is the BPD, and this is the face of the baby. Now this is the coronal section of the baby's face. When you take a section of the abdomen, the rib should be seen on both the sides, preferably one rib, to rule out that it is an oblique section. And you see the heart and the stomach is on the same side, making the situs solutus. You see the baby opening the face, mouth, and this rules out the cleft lip and the upper lip. This is the spine of the baby. Once you see the spine, you have to see the spine from the top to bottom, because they can be myelocele at the lumbosacral region, which may be missed out if you see half of the spine. These are the feet of the baby. Always make an effort to see all 4 limbs, that too in detail, because it can be catastrophic if a baby is born without a limb. The anomalies inside the heart may not be visible immediately at the birth, but the gross and congenital anomalies like cleft lip, the limb anomalies are immediately visible. So all effort should be made to rule out the club foot. All 4 limbs should be seen, and try to spend some time in tracing the limbs, tracing the spine, and looking at the upper lip to rule out the cleft lip. You see both the feet so beautifully, and there's no club foot in either of the foot. Once you have scanned the feet completely, only then you move on to the other limbs, that is the upper limbs. You see both the feet are so beautifully seen, and the baby is having foot presentation. This is the section of the heart, and this is the stomach bubble being seen. Both the feet again, and you can see the cord also being attached. This is the attachment of the cord at the baby's abdomen. The cord attachment should be defined at both the places in the placenta as well as the baby's abdomen, and rule out the herniation of any abdominal contents into the cord. This spine section again, spine should be seen anteriorly. If it is posteriorly seen, then try to wait for some time till the time spine becomes anterior. And now you take the section of the spine in the axial view. I start from the stomach and move ahead and backwards both the sides to scan the whole spine into the axial scan. This is the hand of the baby. This is another hand of the baby. This is the spine in the coronal section. I love this section because it shows the stomach, it shows the heart, and it shows the bladder also. We'll see this coronal section of the abdomen in times to come. See, this is the section which I was talking. Again, emphasis on the feet of the baby. You see the cross-legged baby. The clip again showing the fetus face in the coronal view, the head, the lateral ventricle should be seen posteriorly, and the size should be measured in a view when the thalamus is visible, slightly tilted view from that view, and the horn should be measured at the level when the choroid plexus ends. You see both the arms of the baby. This is the attachment of the cord to the placenta, and on both the ends should be defined. The placental end of the umbilical cord as well as the fetal end of the umbilical cord. Again, you see the feet of the baby. You see the heart. Heart should be seen in four-chamber view, and when you tilt the probe towards the cranium of the baby, then you can see the aortic view, you can see the three-vessel view, and then the pulmonary artery view. Measure the heart rate. These are the fetal kidneys. This is the placenta previa again. The umbilical arteries over the bladder of the fetus, which is well filled. Full bladder means that the kidneys, at least one of the kidneys, is functioning well. And while assessing the fetal parts, you assess the fluid also. See the hand of the baby with the digits. Both the hands should be defined. All the effort should be made to see for the limbs. This is the face of the baby, and this is the nostrils. This is the mouth opening. The baby has closed the mouth. This is the coronal section of the abdomen showing the stomach, the heart, and the bladder. This is the heart pellet. This is the heart again. You see the aortic view. Now three-vessel view, and then again the pulmonary artery view. This is the female length. This is the heart again. This is the lateral ventricle. This is the full bladder. This is how we see the axial scan of the spine. Fetal kidneys, umbilical arteries, again fetal adrenals, fetal